Welcome back to Decouple. Today I'm joined by returning guest, Dr. Geraldine Thomas, who's the Senior Academic and Chair in Molecular Pathology at the Faculty of Medicine of Imperial College London. You may remember her from previous episodes on the scientific consensus around nuclear accidents, where we compared the quality of the literature from a number of competing studies looking at Chernobyl in particular, as well as an episode we did entitled Much Ado About Tritium, which was looking at the health impacts of the tritium water and the release of that water into the ocean at Fukushima. So both great episodes to look back for. Dr. Geraldine Thomas is, of course, also an active researcher in the fields of tissue banking and molecular pathology of thyroid and breast cancer, and she's the director of the Chernobyl Tissue Bank. So, Geraldine, thank you again for making the time to join us on Decouple.
It's a pleasure, Chris.
So today, I wanted to talk to you about a bit of a sticky topic. I had some Irish listeners reach out to me, and they brought my attention to a really interesting organization, which I think has been very influential, both in terms of what it's achieved, the money it's raised, and the impacts it's had on perceptions towards nuclear. So something that I think is well within the churnhouse of this podcast. That organization is called the Chernobyl Children's Initiative. And basically it's an organization that works internationally, but is based mostly out of Ireland, with its director, Adi Roche, being Irish. It's something that I became aware of. I think my uncle had actually worked as a volunteer. And basically one of their big activities is bringing children from the Chernobyl area in Belarus in particular over to mostly wealthy Western countries on what they call radiation holidays. So we'll get a bit more into giving some more context there. So as I was saying, kind of a tricky topic that I still felt sort of compelled to explore. It's tricky to be sort of critical of an organization that helps out children. It's really not my intent to be critical, but it's more, I think, coming out of wanting to sort of understand, the motivations, how this organization came to be, how it came to be so popular, and I think the impacts it's had on public perception of nuclear energy, of radiation, et cetera. So who better to discuss that with again than Dr. Geraldine Thomas? So maybe just to start off, Geraldine, what do you know about this organization? What do you know about this phenomenon? I can fill in some blanks because I've done a bit of research recently, but just, how did you become aware of it? What sort of interactions have you had with folks from that organization?
I mean, I don't know anything specifically about the Irish version of this, but there are a number of different charities that do this sort of thing. They bring children over from the area around the Chernobyl nuclear plant to give them a holiday. I can understand why people would want to do that. You can understand people being sympathetic to children, but to then argue that anything they are suffering from is due to the radiation is not scientifically correct, and I think does lead to an awful lot of misconceptions. I mean, to put it bluntly, the only thing that has increased, the only thing that we can actually say is due to the radiation from Chernobyl is thyroid cancer in those who were children at the time of the accident. It's important to realise that the levels of thyroid cancer drop very markedly once you get to kids who were born after about 9 months after the accident, so say the 1st of January 1987. And we have absolutely no evidence that there's any radiological detriment to anybody born after the 1st of January 1987, apart from people who are scared of the effects of radiation, which of course can lead to physical problems as well, and mental problems. But actually, in terms of the radiation interacting with tissue, the only thing we have is thyroid cancer in those who were young at the time of exposure. So children today are not suffering the effects of Chernobyl. They may be suffering the effects of their parents being scared of Chernobyl, but they're not suffering the effects of radiation damage due to Chernobyl.
Yeah, and I think that's one of the sort of claims that underlies and justifies the existence of this organization, which again, I mean, Belarus is an underdeveloped country, particularly underdeveloped in terms of social services. And this organization has gone in, started a number of orphanages, care centers for the children, a hospice center. But that's all based on the premise that I don't think they make the claim that sort of every congenital abnormality that's occurred in children after the Chernobyl accident is directly attributable, but they sort of say, well, certainly, their implication is that a good number of them have been. There's a very interesting, actually, it won an Academy Award as a documentary. It was called Chernobyl Heart. And it followed Eddie Roche to the Chernobyl plant and then to affected communities, again largely in Belarus and Ukraine, tours of orphanages. I mean, really emotive filmmaking from the perspective of following this very well-meaning, compassionate Irish woman to these orphanages. Handling these babies with the most terrible, hydrocephalus, with other birth deformities. I mean, it grips your heart, and I guess it did. I mean, it's a pretty terrible documentary, to be honest, but I can see maybe why it won because of how it pulls on emotional heartstrings.
Sadly, I can take you to any country in the world and show you the same thing. About 3% of children are born with some form of birth defect. Now, there's a huge different scale of types of birth defect. Many of them you can't see their heart defects they don't become apparent until you become clinically involved. But I'm afraid an awful lot of people are actually born with birth defects, and I've been to many places, and I mean I've been out to Japan and places like that, and you see them in every society. You can't just say this is all due to radiation, because it's clearly not. But I can understand people wanting to help kids in that situation, and when you have a country like Belarus, which has a slightly different social structure to Ireland, the UK, or Canada in terms of dealing with children with defects, with both learning difficulties and physical difficulties, you can understand why it must look pretty horrific. And if you have something that you can pin it on and say, well, this is due to radiation, I can see why people would make that jump. But scientifically, there is just no evidence for it. We have no evidence at all of any defects caused by radiation. That's simply because the radiation was so low. And actually, if you know the literature, you'll know that there's a specific age range when you're in utero that you are at risk from radiation exposure, and that is 18 to 25 weeks. Below 8 weeks, 8 weeks to 25 weeks, below 8 weeks and above 25 weeks gestation, there is no effect of radiation. And actually, your mother at the time, obviously because it will be the mother that's exposed, has to have quite a large dose of radiation to get anywhere near enough dose to the child to have any effect on their development. And those are mainly neural developments as well, not physical developments.
Okay. So neural in what sense?
Defects in the neural stem growth and that sort of thing as the brain is developing. So what you tend to see is mental capacity impairment and that sort of thing, rather than the sort of gross abnormalities that you're talking about, like hydrocephalus and things like that. They could never have occurred at the doses that we know the population was exposed to, but really and truly that's not the sort of thing you see post-radiation.
The other claim is that there's been an epidemic of congenital heart defects as a result of Chernobyl, the so-called Chernobyl heart.
It might actually be that what people are actually seeing is they're now actually getting the medical attention to find this is not insignificant. There is a very large number of heart defects in any particular population. Several members of my family have got a heart defect. My husband was born with a heart murmur. One of my cousin's children had another child who had several holes in her heart. Nothing to do with radiation. They just occur naturally, unfortunately. And if you're in an environment where you're going to pick those up, where your clinical screening has improved, possibly because you have people going in with charities going in, you are going to pick up more. But it doesn't mean it's due to the radiation. It can be clinical ascertainment, and that's what you have to be so careful about this. When you look for something in medicine, you find it, especially if you use really sensitive techniques. And you have to know whether you're finding it because you're looking for it, or you're finding it because something else has changed in the environment and is leading for it to develop.
And we've talked about this, I think, in our pre-chat for this conversation about something like cancer or like a congenital abnormality. It really kind of poses this question to the sufferer, to the parents, what caused this? Am I at fault? What is at fault? And when there's really no explanation, that's psychologically very difficult to tangle with.
Absolutely. I'm a mother myself. If something had happened to one of my children, I would be looking for a reason why it had happened to my child and not somebody who's next door. My brother is autistic and epileptic. Why is he autistic and epileptic, and why am I not? What happened to him that makes it different? You have to find a reason. I think it's the way we're sort of made, is to say, I must have a reason for this. I can't believe it happens by chance. But the evidence is an awful lot of it does happen by chance. It's amazing, actually, if you actually think about what we have to go through from being that fertilized egg into an adult human being, that so many of us look normal and are normal in what we term as normal. It's actually amazing that we don't have more problems, because it is a fiendishly complicated process which can go wrong at any point.
Yeah, I was just treating a woman with a miscarriage on my shift last night, and I always go to great pains to do a bit of a talk around it, because I mean, even the word miscarriage, it sort of infers that you've dropped the baby in a sense, or you've screwed up as a mother, that your womb was inhospitable, and there's just such a tendency. I think just because of how egocentric we are as human beings to, the world revolves around it. It must have been something that we did, maybe it's because, me and my husband had sex a few days ago, or maybe it's because I was at the gym, and just doing things that keep moms physically and mentally healthy, especially during a pandemic. But that again, it's almost exclusively these first trimester losses are related to, the chromosomes not aligning properly. There's survivable congenital and chromosomal abnormalities like Down syndrome, but there's many that are not. And the baby just doesn't, they develop up to a point, or the fetus develops to a point, and then it's no longer viable, and the body expels those uterine contents to get sort of hyperclinical there.
I mean, I can relate to that. I had a miscarriage. My first child ended up in a miscarriage, and it's believed that between 10 to 24% of miscarriages occur probably even before you know you're pregnant, because obviously you don't know you're pregnant until you've missed a period, and you may sort of ignore it for a bit longer, thinking, I'm just late, until you actually do the test to know you're pregnant. So many people actually don't even realise they've been pregnant and they've lost a baby. And it is life's way of trying to make sure that we get the best out of it, and that normal pregnancies will go to full term, whereas those that are clearly not going to go to full term, we tend to lose early.
Yeah, I've heard it's as high as sort of half of all conceptions don't make it even to sort of the level of detection, and then we have firm stats that 1 in 5 detected pregnancies end in a miscarriage, and that's that's something we hear in terms of some of the COVID or the anti-vax crew really suggesting that there's been an increase in pregnancy losses as a result of vaccination, and you can see again there's a real need to explain this very common fact of life and trying to attribute it. I think that's kind of an interesting parallel. We reference, is it, did I sin? Is it a religious issue? Is God punishing me? Like, we human beings just always need to find that explanation, it seems.
Yeah, I mean, it's a sad fact at the moment, because we're going through a peak of COVID, like you are in Canada as well, that actually there's a real plea going out to pregnant women to get vaccinated, because we have so many of them who are not vaccinated, seriously ill in hospital, because they've been scared to be vaccinated because of all the, I might lose my baby might suffer because I'm having the vaccination. So I can see why people would have been reticent, but actually they're ending up in hospital and putting their own life and the babies at risk. So, this negative stuff really has real world consequences, I think.
Yeah, no, absolutely. I've seen that personally in my clinical work. I had a woman in about 34 weeks pregnant who needed to be delivered immediately because the mom was in respiratory failure. And one of the treatments for respiratory failure in a pregnant woman is to get the baby out so the lungs can expand into the diaphragm. So, they have more lung capacity. But yeah, there are very severe effects on pregnant women. It's interesting. So again, one of the sort of central premises, we've talked a little bit about what the impacts, what the science says about what the impacts have been. And just to reiterate that again, it was thyroid cancer exclusively to children?
Thyroid cancer exclusive. We have no evidence of any other cancer increasing at the moment. We're still looking, obviously, because we're only sort of 35 years-ish past the accident, 36 years this year, isn't it? So, You can, at this point, we cannot definitely say there is anything else, but there's certainly nothing else rising that we're aware of that we can point the finger at radiation from Chernobyl for causing, which is interesting because we were expecting to see an awful lot more, particularly in the groups of people who had higher exposures because they were involved in the cleanup. So you have the two groups. You have the higher exposed emergency worker cohorts, and then you have the people who just happen to be living close to the area, so they weren't involved in going into the actual site itself, but they were exposed from the volatile elements that were in the atmosphere as a result of the explosion at Chernobyl.
Mm-hmm. And can you just go in very briefly again to the reasons why, the radiologic and biologic reasons why the iodine 131 had its narrow impact on children of a certain age and only for a certain amount of time?
Yeah, I mean, there's several factors. First, the child's thyroid is very small. It's also growing because it has to obviously get to an adult size. So you have the radiation, which is a mutagen. We know it causes DNA damage. And then you get growth of the mutated clones because of natural growth of the thyroid. Children also drink more milk. And we know that contaminated milk was one of the major sources of radioiodine, much more than inhalation. So they've got several different factors that make them much more likely to have an issue with radioiodine. We know from loads of other clinical studies, for example, that where we've used radioiodine in treatment for various things, that actually once you get to a stage where your thyroid's no longer growing, you don't get cancer. So even if you had the same dose as a child, you would still not get cancer because your thyroid is no longer growing, whereas in the child, obviously, it's growing to an adult size. So there's lots of reasons. They drink more milk. They have this growing thyroid. They have a small thyroid, which means that the beta energy can be spread more into the thyroid tissue than it can in the adult thyroid. So, there's several reasons there. But we just do not see an increase in adults. And where people get confused is where we're talking at exposure in childhood. As those people grow up into adults, they carry the same risk with them. So now, of course, we're starting to see more people, more adolescents and more adults now because it's 36 years past. So that peak has moved into the 36-year-olds, but it was because they were exposed to children. If they were 36 when they were exposed, they wouldn't have got thyroid cancer.
And again, the iodine, I think, has a half-life of 8 days. So after about 80 days, it's out of the environment.
Yeah, it has a half-life of 8 days. So within 3 months, all the iodine had gone from the environment. Okay. But it has a short physical half-life, but your thyroid concentrates iodine. So it's a bit like a sponge. It will take it up and it will hold on to it like a sponge does when you put it into a bucket of water. And because it's got a short physical half-life, it will then emit its radiation while it's inside the thyroid gland. So that's why and the thyroid particularly takes up iodine. It's the only organ in the body to take it up and store it. So that's why it's so related to thyroid, and it's so related to children because of the fact they drink more milk, so the doses are higher effectively, and their thyroid is growing.
And in terms of numbers, again, I'm just trying to think, like the children that were helped by the Chernobyl Children Initiative, what proportion of those would have actually been as a result of impacts of the radiation? Presumably some children with thyroid cancer may have gone over, but what sort of numbers are we talking about?
Well, we think about 10 million children were exposed, and we would estimate the total number of thyroid cancers caused by the radiation over about a 50-year period. So this is, children exposed very young, but who've grown into adult life. About 1,600 of those, 16,000 of those would be caused by exposure to radioiodine. So 10 million versus 16,000. So only a very small proportion of people, but because thyroid cancer is very rare, that's why we know it's happened. It's naturally very, very rare. So if you see an increase of 100-fold, that's a big number, and you can spot it very quickly.
And in terms of the treatment of thyroid cancer, what does that look like, and what do the side effects look like? Is this like hair falling out? Like my mom's friend actually is a Ukrainian painter, and she has like some haunting images of children who look like they've gone through chemotherapy and they're bald and their skin's falling off and stuff like that. I mean. Yeah. It's such a strong such a strong cultural motif. It's in art, it's in charities, etc. But what does that treatment cycle look like? I mean, I'm in the emergency department, so I don't do pediatric oncology. But what is that? What do kids look like going through that treatment program, or young adults or adults now?
Well, basically, the routine is that the child will undergo usually a thyroidectomy. Depends on how big the tumor is, where it is, etc. But usually a thyroidectomy. Then you have to replace the thyroid hormones with small tablets that you can take that are very cheap to make. But also you may want to follow up the surgery with high dose radioiodine treatment to mop up any of the thyroid cells that you didn't manage to take out through surgery. But you can only have that done if you've had a total thyroidectomy done. And there's no chemotherapy or anything. It's a very targeted therapy. So if somebody has chemotherapy, you do expect their hair to fall out because it affects the hair follicles, but the iodine won't. So the children's hair don't fall out. Some of them may have gone on to have external X radiation later on in their journey, but not very many of them. But thyroid cancer is not like your genuine cancer that everybody thinks about. The classic picture of hair falling out, etc. No, because it's targeted to the thyroid. That's why it's such a targeted. I mean, that's what we try to do with all new cancer treatments: is make sure they only hit the tissue and only the cancer within the tissue. And that's the beauty with thyroid cancer, which is why it's almost virtually curable. Only about 1% of people who get thyroid cancer will die from their thyroid cancer, is because we have such a brilliant targeted treatment, which ironically in this case is high doses of radioiodine.
So for that 16,000 with a 1% mortality rate, we're looking at 160 deaths.
Exactly, you're looking at 100. If we reach the 16,000, and we might actually, because we're finding this tumor quite early, because we know it's there in the population, so we're actively looking for it, and people know where their thyroid is. If you see it early, obviously you can treat it better. And so the 1% is what we're working on at the moment with the figures that we have, but it may even be less than that. We just, it could be better. It's unlikely to be worse from what we know, but it could even be better.
And I mean, and let's be clear that it sucks to have a thyroidectomy, and it sucks to have to have radiotherapy.
You'll have to be monitored for the rest of your life. You have to make sure your thyroid hormones are in the right level to make, because the thyroid hormones cover the whole of your metabolism, so they're really key hormones. So yeah, nobody wants to undergo this. Particularly, for a young person, they don't want to undergo it. And you will, of course, be left with a scar on your neck. And particularly if you're a girl, you might find that that's difficult to live with. So no, nobody wants to go through it. But actually, compared with other cancers, this is a lot less worse than you would expect to have. It's a much better prognosis.
Yeah, no, just to be clear, I just didn't want to come across as callous or kind of minimizing that impact, but I think it is.
Yeah.
But I do think it's important to really establish what the science says about the impacts of Chernobyl, so we can make the right decisions going forward and make the right energy choices. And going back to Ireland, there's a ban on nuclear energy in Ireland that came in 1991, I believe, so 5 or 6 years. No, maybe it was 1997. Oh God, I'm losing my research here. But it's a ban. I'm not sure to what degree the Chernobyl Children's Initiative had to do with that. I mean, it is just heading back a little bit to some background research on that organization. They've raised over $100 million. One of the big fundraisers is Bono's wife. They've brought over 25,000 children to Ireland, usually to stay, I think, for sort of 2-week to 8-week summer vacations. The claim is that a radiation holiday, on average, apparently adds 2 years to these children's lifespans. The citation needed, says Wikipedia.
But I mean, by all means, bring them over for a holiday. They do. The areas they come from are fairly poor areas. I'm sure they love it. They probably get more of a radiation dose flying in the plane from Belarus to Ireland, actually, than the radiation dose in. I mean, that's the sad thing about it. People forget that you are exposed to radiation everywhere, and flying in a plane actually increases your radiation dose because you are closer to the upper atmosphere, which means that you'll get more cosmic radiation.
No, and I mean, it's so interesting, kind of knowing what I do now and having talked to Ida Ruizhalm, who's someone who's traveled to Chernobyl with a scientific team, and who's brought her dosimeter, her Geiger counter with her on the planes, and figured out what her doses were, and they were higher on the trip there in the airplane. So air travel was the greatest source, despite being in the zone for I think around a week.
Yeah.
And this Chernobyl Heart, Academy Award-winning 30-minute documentary, it really is, a study in radiophobia. I'm not sure if Addie or her film crew also understand that they got the most radiation in their trip from the flights, but. In addition to touring some of the Belarusian orphanages, one of the things they do, and they show you like how terrible. I mean, even with the assistance of the Chernobyl Children's Initiative, I mean, kids growing up in care. I mean, in any country, it's not ideal compared to being with their families.
But in a poor country, it's even worse.
The neglect, the lack of stimulation, just sitting in a crib most of the day. But one of the most one of the most shocking parts of the film is she goes to visit a family who still live within the exclusion zone. I'm not sure where. She does a radiation measurement, which isn't actually that high, and then says, well, any dose of radiation is very dangerous. But the thing that was really shocking to me is she kind of barges into this household where there's a family, mixed generation family, including some kids, and she's being told, they're swatting at the cameras, get out of here, and the whole film, it's very kind of maybe exploitative of children suffering in the way it's shot.
Yeah.
And so seeing this family being like, just get the fuck out of here. We don't want you here. We don't want your cameras here. And sort of having the camera up in the kid's face. And then, as she's leaving the house, she says that child should be in an orphanage. They should be in care because it's so dangerous for a child to be growing up here. And after having just toured the orphanages and understanding some of the literature on the impacts of, children growing up in care, it was a really probably the most shocking moment of the movie for me.
Yeah. I mean, the worst thing you can do is remove a child from its parents unless those parents are incapable of caring for that child. And those parents clearly weren't incapable, but from what you've just said. So, I think you have to be really careful about going into another social grouping in another country and imposing what you think is right on it. Because the culture is very, very different over there. And what really does bind them together is their community and social ties. And I know some of the areas out there are still desperately poor because nobody wants to bring any outside work interests there because of the radiation. Whereas, if you talk to people like Jim Smith, who spent an awful lot of time in the radioactive areas, as opposed to somebody like me who's been working with the medical staff in Kiev, which is quite away from the reactor. If you talk to people like that, he's trying his best to get some form of economy going out there because they just want new investment. They want to preserve their communities. They want to make sure they can keep staying on their lands. They're not frightened of the radiation. They don't think the radiation's a problem at all, but other people think it is and tell them it is. And that means that the money doesn't flow in for, businesses to thrive.
No, and I mean, one of the scenes from the film as well is, adolescents going to get like a cesium total body count from a scanner, and and the filmmakers are sort of asking them very leading questions, and I think, as you mentioned before, one of the big impacts is health impacts of Chernobyl is both the social fracture of the displacement, the reaction and the fear, but also the fatalism that leads people to say, whatever, why would I quit smoking? I'm going to die from Chernobyl, or why would I quit drinking? And seeing these teenagers growing up, with that haunting them. You've addressed the question of cesium in our past episode, but in terms of, we addressed iodine 131. Cesium seems to be the next greatest threat in terms of at least the radiologic profile in terms of 30-year half-life.
Yeah. In terms of release, it was the other volatile element that would be of concern. But in actual fact, because it has a very long physical half-life of about 30 years and a short biological half-life of about 100 days, the actual dose that you would get from taking in a given amount of cesium is very, very small. So to give you an example, 6 million people who live, you talk about the exclusion zone. I think it's the zone just outside the exclusion zone. It is where most people are living at the moment, because there are people living inside the exclusion zone. They're not supposed to be, because that's what an exclusion zone is supposed to do. It's supposed to exclude people. But the general population, the larger population, lives just outside on the margins of it. And about 6 million people in that area got a dose of 10 millisieverts over 20 years. That's how long it took the cesium to give them that dose.
Yeah, when I have a trauma patient rolling in, I need to do we call a pan scan, basically a chest, abdo, pelvis. They're getting 10 millisieverts in 2 seconds.
Yeah, exactly.
Right.
So, when dose is so intrinsically related to the health effect, the lower the dose, the lower the health effect. you can perhaps see why, that's why cesium isn't doing anything. And that's why we should stop worrying about the cesium in those areas and help the economy thrive there. That's what would help those people far more than anything else. Good jobs, good education, that would be far better than going in and ranting about the radiation, which isn't causing any health effect. Whereas, of course, the social deprivation, the biggest factor in causing a health deprivation.
And yeah, I mean, Ida Rieshelm, I really encourage listeners to go back and check out that episode. But she talks about visiting a town that kind of it was right on the edge of the exclusion zone. And strictly speaking, if you just drew a circle, it would be inside. But they created a little indent for it because, I don't know, it was politically unpopular to evacuate. It was a decent sized little city. But what she was saying is that basically they're forbidden from building any new buildings. I think they're maybe still allowed to patch a hole in the roof, but it's a kind of dying city. There's children being born and, going to daycare and things like that, but they're not able to sort of grow their town or for it to really prosper because of the restrictions in place.
Which 36 years later is that level of cesium is declining now very, very quickly because we're past its initial half-life. So it's a shame. You can understand why they wouldn't want to build. They don't want to disturb soil and therefore raise dust, which would has the potential to raise isotopes in the atmosphere. So you can understand why they don't want to do that. But effectively, it's a death sentence for that town.
Yeah. It's not a ghost town, but it's
youngsters will leave. And once the youngsters leave the community, that's it. It's on a hiding to nowhere.
Yeah, totally. So again, we haven't touched on this part of the science yet, and I know there's a new article that came out relatively new, April 2021, looking at transgenerational effects. I think in the liquidator cohort, but I think that's the fundamental claim of the folks at Chernobyl Children's Initiative and the justification for, again, a lot of the great work they do in terms of setting up orphanages, building up social services within Belarus, and flying kids for vacations in wealthier countries. It is on the premise that most of these congenital abnormalities are as a result of transgenerational effects. So can we touch on the science behind that and what the best literature is telling us?
Yeah, this was a whole genome sequencing project. So basically looking for any little change you can possibly find in the DNA. And what they had was triples. So they had 3 blood samples, one from the mother, one from the father, and one from children. Sometimes they had more than one child if they'd had more than one child in the family. But basically either the mother or the father, and occasionally both, but it was usually mother or father, had been exposed to much higher levels than the general population had been, because they had been cleanup workers in the Chernobyl nuclear plant. So dosimetry enables you to work out exactly what the dose was to the gonads, to the testes in the man, or the ovaries in a woman, and they then sequenced. So took the whole genome, sequenced the mother, father, and child, and looked for changes that were related to the radiation dose. So obviously, the higher the dose, you would expect to see more. They couldn't find anything. They couldn't find any changes related to radiation. They could find changes that were related to the age of the father at the time of conception and whether the father smoked. But they could not find anything related to the to exposure of the parents, who then subsequently had children. Could not find any relation to that to mutagenesis in the child. So that shows you, this is something that we know from other studies. This is not surprising. Even after the atomic bombs, there was no increase in gestational issues with people who had been exposed and then subsequently went on to have children. There were some instances where people had been exposed while pregnant and living in, very, very close to the epicenter, which resulted in largely neurodegenerative condition and things like that. But there were very few cases because they had to be extremely high doses, which means the mother had to be able to survive the extremely high dose to give birth to the child later. To those where parents had been irradiated as part of the bomb and then subsequently went on to have children, they couldn't find anything at all. And those doses quite often would have been quite a bit higher than would have occurred at Chernobyl. So this is not surprising. And we also know there's this 8 to 25 weeks in gestation, which is very important. But apart from that, either side, you're okay.
And I guess the other high dose population that you might expect to see those sort of impacts on children of parents exposed to radiation would be maybe folks with lymphoma that are being treated with high dose radiation. Is that something you're familiar with? Is in terms of finding other populations with high enough dose?
The other problem with that is, of course, you've often given them chemotherapy as well, and it tends
Yes.
to knock off their ability to have children. So you have to be really careful, because there's two different things. There's the ability to have children, so people may have difficulties in conception because their germ cells have actually been attacked by the chemotherapy rather than the radiotherapy, actually, usually. So you do have instances of that, but again, there's nothing to see, I'm afraid. So, where this comes from, I don't know, but it really is. I find it one of the worst aspects of radiophobia, because I've met people in Japan who took the decision never to have children because they were exposed to radiation from the atomic bombs. So you've deprived somebody the right of having a family, which is a fundamental human right. You've deprived them of that because you've made them too scared to have a child because they think it will be born deformed, when there is no scientific evidence for it whatsoever. And I think that paper in Science really put the nail in the coffin of that one. If you can't find it with whole genome sequencing, you're not going to find it with anything. Because even if you found something with genome sequencing, you've then got to go on to prove that actually that functionally made a difference. But they found nothing.
Yeah, of course, it's the knowledge translation of that article versus a highly emotive photo of a child with a disability attributed to Chernobyl. It's very tricky, I think, to convey that.
As a scientist, you have to divorce yourself from your instance to want to put your arms around the child and protect it. You have to say, yes, the child's been affected, but do I know it can be attributable to the cause that I'd like it to make it to be? And as a scientist, you have to stand back from that and be able to say, well, no, it's not that. Because if you don't stand back from saying it's not that, you will never find out what these causes actually are. If you jump to conclusions, you can make a very wrong step in the wrong direction, whereas actually there may be something else in the environment that might be doing. I doubt it from what I've seen and the knowledge I have of the literature. I think this is just the normal frequency. I mean, the other thing that you should remember is that alcohol also can cause congenital aberrations as well. So don't forget, that you have to take into account other things that you might be taking in from drinking, smoking, etc. As I'd already said to you, that the one thing they did find on that study was fathers smoking. Actually, you could see the signature in the transgenerational mutation phenotype that way. So radiation is not the only nasty thing we're exposed to. There are lots of other things we're exposed to.
I think that's one of your big talking points and presentations I've seen of yours is that the focus we put on radiation robs us from looking at the much more influential causes of cancer within
Absolutely.
a population. Yeah,
absolutely. Yeah. And that's where you have to have that detachment as a scientist, because you can go completely off down the wrong track if you're not looking at this and saying, where's the evidence? I was always taught to look to the alternative hypothesis. So you say, this is my hypothesis. This is my experiment that I have designed to help me prove this hypothesis. Oh, look, my results fit my hypothesis. And then you go, okay, so what else could have given me the same results? And then you go off and prove that those could not have given you the same results. So it's a long, protracted process. But if you do it that way, you will get to the right bit of the science. If you don't do it that way, you're likely to be led off in completely the wrong direction.
And it's interesting, as a physician trained in the noughties, I always love the British way to refer to the early 2000s. The paradigm shift that had been occurring was towards something called evidence-based medicine, because clinicians
Absolutely.
can be led so far astray by by certain interactions with patients or certain patterns that we might see by chance alone, not seeing an enormous number of patients. And I think that's something that we've been trained to try and look beyond and reference, epidemiologic studies, randomized controlled trials, to really search for the evidence, because we can be led astray. And I think, according to Adi Roche, the reason for founding the organization was an appeal from Belarusian doctors who were seeing, an increase in these health conditions. And I think for reasons we already discussed, including trying to seek meaning and understand a phenomenon. it's easy to make a misattribution based upon, as a clinician, I say that with the humility of
Yeah.
probably being guilty of that. One sees it with COVID, certainly, where you have a disease that's very, very survivable, and there's physicians who are treating with therapeutics and saying, "Listen, I've treated 400 patients with ivermectin, and I'm getting great results. They're all getting better." And it's like, well, what's the natural history of this disease?
Absolutely.
So,
I mean, it is. It would be lovely to always have your gut feeling proved right, but unfortunately, there are an awful lot of instances in medicine where that's not been the case. So the only way to do it is to stand back and look at the science and try and work out really what is causing this. But and to see an increase when you're a doctor, and you could understand why, as a doctor, suddenly seeing more people coming forward, who might be people who are coming forward thinking, "Oh well, now this has happened, there might be more help on offer." So they're actually bringing it to the doctor's attention. You could see why the clinicians might think, well, maybe there is something to look into this. You have to remember that with where there is money in the background, always be very, very careful, because some people will be looking to obtain money and things like that as well. You also have to. Unfortunately, that is just the way human nature works. I wish it didn't, but that is just the way it works. So you need to be really sure of what you're doing, and you need to be able to divorce yourself from the emotion in order to do it. And I can understand why it happened like that, and I can understand why people would think, oh well, radiation, we know it causes this, but actually, if you read the literature, it doesn't cause what they think it's causing either. And you can understand with the popular misconceptions why somebody would say, I want to do something to help, and I can do this. But actually, by helping them the way they're helping, they're actually not helping at all, because what happens when people get bored with Chernobyl? That help will disappear, but there's nothing to say that society has changed, so they will look after those children better in the future when more children are born because of what happens naturally. You haven't actually improved society by doing that, whereas it'd been much better to be going out and improving society and helping economically so that Belarus could better support future generations who unfortunately are born with disabilities of one sort or another.
Yeah, I mean, when I was looking at the organization, I was asking myself, well, why Chernobyl and why not Bhopal, which is, I think, widely understood as the world's worst industrial accident.
Yeah.
Again, a chemical mutagen, and it very much is, I think, explainable by anti-nuclear weapons activism that transmutes into anti-nuclear energy activism. And again, I mean, this is I think the most successful charity in Ireland, raised over 100 million euros, and brought an enormous number of children over. It was interesting. One of the articles I was looking at was, some of the political opposition figures in Belarus were children who had come over to the West and sort of seen essentially a free country. So it's had really broad impacts. And it's just for me, it's just a very interesting phenomenon. Just the size of this charity, why it became, Ireland's, I think, best funded charity. You mentioned sort of Chernobyl fatigue, but I mean, it's still, I think, quite a large operation and carries on with its work. So anyway, it's a fascinating story. Thank you for coming on as a scientist to share to shine some light on the underlying biology and medicine underpinning the consequences of Chernobyl through this, I think, very, very fascinating example. And I think I'm sorry I didn't write down the name of the listener who suggested I cover this, but I think a very interesting topic, and hopefully one that we've covered with humanism. And I think
I think it's important to say, Chris, I'm all for charity, and I'm all for helping areas of the world that are less privileged than we are. But what you mustn't do is promulgate a myth that then actually negates what you're trying to do. So, I'm more than happy for these people to go and help the poorer areas of Belarus, but to say that they're doing it because Chernobyl caused all of this is wrong. It's scientifically wrong. And actually, in the longer term, it isn't going to help. What you need to do is to try and persuade the Belarusian government to be more responsible towards people who are less able to look after themselves. And that to me is where we need to be going, rather than trying to blame the radiation. But I'm not saying don't raise the money, and I'm not saying don't help people. I'm saying do it for the right reasons. Don't try and blame something that it can't be held to account for.
Right. And I mean, the harms of radiophobia are well known, and the impacts of that fatalism,
Yeah.
which is, reinforced, I think, by the narrative of this
And I think
organization.
nicely, the COVID-19 thing has actually, brought into focus the fact that being anti-science and not listening to the science can cause an awful lot of problems and can cause huge problems socially within your societies. I don't know where we're going to go with the COVID vaccination in this country. More and more places are saying you must have your NHS app showing your your vaccination status. There's a lot of fight back against, stigmatizing people.
Yeah.
But
Yeah.
I think we've learned that if you let people who ignore the science and just work on their own opinion rather than looking at the science, it can be highly detrimental to your society. I hope that's the one thing we have learned from this awful situation we've been in for the last 2 years. If we haven't learned that, we really are in trouble.
Okay. Well, we'll leave it on that note. Dr. Thomas, thank you once again for coming on Decouple. I'm sure we'll have you back at some point. You're a very valued expert. I kind of see you as a bit of a scientific advisor to the podcast. So
thank you very much, Chris.
thanks for your help.
Thanks, okay. Then. Bye.
We'll talk soon.